powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to another episode of the Healthcare Connections podcast. I'm your host, Jeremy Winn, the Director of Sales and Marketing here at Healthcare Compliance Pros. We've got a fun guest on today. I've really enjoyed getting to know Katie Taylor. She is the Executive Director of the American Medical Billing Association, which is more commonly known as AMBA. Or I notice you say the AMBA because that's grammatically correct, but I do notice that because I just say AMBA and you always correct and say the AMBA, and I love it. So welcome, Katie, to the podcast.
I don't even know why that's a thing for me, but I guess whenever I'm like writing out professional things, I always put it there. So yeah, I probably do, but it's not meant like I'm not like, yeah, you got it wrong.
Just so you know, I appreciate it.
We are an association for medical billers and coders, and we offer continuing education. We certify medical billers and coders, and we offer just an opportunity for people in the industry to network with one another and to stay abreast of industry changes. And that's, in a nutshell, what we're all about.
Yeah. So there's a great story behind the AMBA. I'm going to just say it now because I have to. So Katie, take a few minutes because I know you've been with the organization a long time, but it actually started with your parents. And so maybe give us the backstory from the beginning. I think it's really neat how this thing has evolved over the years. And now as you, I guess, take over, I don't know if your parents maybe are ready for that, but really, Katie taking over at this point. So tell us the whole backstory.
So, my mother, Cindy Weston, she was the first medical biller in the state of Oklahoma to file electronic claims. And as she, wanted to grow and advance in her career, she knew there was associations for medical coders and for providers and nurses, and there really wasn't any outlet for medical billers. And so she had started offering training sessions every other month in Dallas. And we'd go to the embassy suites there and she'd teach a class all day on Saturday. And she had a lot of success with that. She made a lot of great connections with people there and at different trade shows, and realized that, that there's just this need for an association. And so that was how AMBA was born. And the association was started in 1998. And Larry is my father, and he's always been there every step of the way as well. He has done a lot of the conference development over the years and a lot of working with our vendors and sponsors. Um, but in 2000, that's when we started doing our annual national conference in Las Vegas. And that's also when we released the first medical billing credential in existence, and it still exists today. We have over 10,000 credentialed medical billers with us, and I really love what I do. I have been working for AMBA, I like to say, since I was just a little kid. I had went to college and came to work at AMBA while I was in grad school. And, at that point I wasn't quite sure, where the future led, but the longer I was with AMBA, the more I realized that that's where I wanted to be. And that's kind of where my heart lay is with this organization that I've watched my family grow from the ground up. And, we really pride ourselves on, not drastically increasing costs, and we like our members to know that they are a name and not a number with us. And I really love what I do, and I'm glad to be the executive director.
Yeah, thank you. So is the torch officially passed? Are you kind of like, hey, mom and dad, don't worry about this anymore?
Well, so Larry and Cindy, they have lots of hobbies and different things that they're up to now. Larry, he does a lot of farming. He has cows and he does hay. And Cindy has a lot of different hobbies that she spends her time doing. She's still pretty active on the AMBA Facebook groups, though. She is. And Cindy did not make it to conference last year because of some health setbacks. She's doing really well now, but I
Right.
think Larry probably only came last year just to make sure he kind of sat back. That was y'all's first year at the conference,
That
right?
was our first year. Yep.
So normally Larry's a lot more involved and a lot more on the face of things at the conference, but he did sit back. Like I could tell that he made a point to kind of let myself and the team handle everything. And I think he saw that, you know, that he might not have to go back to Vegas. So we'll see. I'm not quite sure yet if he's going this year, but I have a feeling he's probably going to not go
Yep.
if he doesn't have to. And
Wonderful.
I
Well,
support that. Everybody who works hard and who, has put in all of these years, um, perfecting their career and their crafts, everybody deserves to have that time of retirement
yep,
and that time to enjoy that season of life.
I
So,
agree.
I'm
I love
excited for them, and I know
great.
they're excited to see where AMBA's headed and, our new partnerships, like with Healthcare Compliance Pros.
Yep. Yeah, we're excited about that too. And it was our first time attending, and we were really impressed with the conference. And that leads really well into this. The next question I wanted to ask you is, there's lots of medical billing companies out there. Many of them don't belong to national organizations. Talk to us about some of the benefits that you see your members receiving by being a part of AMBA.
So I think that just having that place that they can call when they're unsure or they have questions or they just have, one of those crazy days or you have that one claim you've been fighting. It's nice to have that home base to call to say, "Hey, I really need help with this," or to even just live chat us or email us. But also, we provide a lot of free education to our members. So all of
Yeah.
those webinars that we do each month, we keep a repository of those in the member portal, and they're all online. And you don't even have to download anything to view them. You just stream them within the member portal. We offer discounts on our courses and products through the member portal. You get a discount on coming to conference. And we also have a couple of Facebook groups that are for members only. And you get our monthly newsletter as a member, and that has all of the latest industry updates and all of the announcements within the organization. But, the people that get involved with their organizations that they're a member of, they're able to make these lasting professional connections that a lot of times turn into friendships too.
Yep. Absolutely. And I've noticed, you as a group, as an organization, and you yourself, very active on LinkedIn in particular is where I see you, but I'm sure all social media. And I'm always impressed with the amount of, I would say, free content, like you mentioned, that you put out there. It's amazing, the information, the learning opportunities just to get better. And then I think the power of the network, as you just mentioned, the Facebook groups, to be able to ask questions and get advice from other seasoned experts in the industry to help guide you. It's, you know, it, as good as AI is, it can't quite duplicate experience. At times, you can go ask questions to Chat GPT or any of your go-to AI tools, but to be able to call on somebody that has done it from a day-to-day basis and understands the nuances, to me, it adds tons of value.
Yes, and a lot of times providers will say, "Well, I need proof of what you're telling me." And sometimes that is hard to find depending upon what the topic is, what the issue is, and if it's different at the state level, and
Yeah,
find state by state regulations. So just like I said, having that resource and having that community to reach out to say, "Hey, I know that this is how it is, but I need the actual proof from a government or state website or something that I can give to this provider." So that, they can get on board with me.
absolutely. Okay. Next thing I want to talk about, you mentioned partnership that we were able to form this year. And it really was just as we were so impressed with your organization at the conference. We talked about putting together an AMBA accreditation program around compliance. And I know it got you pretty excited because it's a
Yeah.
big deal. It's a big deal to you to make sure that your members are protected in all, lots of areas of their business. So talk to me about, from your perspective, why you got excited about this potential accreditation program, the value that you see it bringing to your members.
Sorry, we've been having a lot of different weather here, so I have some allergies and I'm trying to keep my nose from running.
I didn't make you emotional because you're just so touched by
Yeah,
this
yeah,
conversation. Okay. All
yeah.
right.
It's an emotional day. Um, so when we were talking at conference, I thought this is a great opportunity for us to work with a HIPAA compliance company. I feel like that is a really good resource for people alone without the accreditation component because a lot of times that is, sad story is that people just have this book that's gathering dust that's not a living document and they're not going to be able to feel protected if they ever get audited.
Yep.
Um, when they pull that dusty book off the shelf and say, no, I haven't looked at it in 5 years, or I don't even have one. So I'm always on board with working with a compliance company that's going to help you manage it and make it easy for you and just say, here's one thing that we can take off your plate that you don't have to worry about. But with
Correct.
the accreditation, they're going through this stringent process. They are able to say, I checked all of these extra boxes besides just doing the basics that I have to do to stay in compliance. I went above and beyond, and I have this seal of approval through these organizations, and they're able to give it to their providers, potential providers, especially.
Right.
They like to see that when it's, you and one other medical billing company, and you have that accreditation in compliance and everything else is pretty similar, they're going to pick you because that's a safety that's a feeling of safety for them.
Absolutely. Yeah. That competitive advantage that we've seen this have for those groups is a big deal. And one of the most common ways that a physician or their practice get in trouble is usually through a business associate. So, one of their suppliers, vendors, could be their billing company that maybe has an issue, some sort of breach. And sometimes that can bleed over to the practice if they don't have, proper business associate agreements in place. And so for a provider, it's a big deal to say, okay, I'm going to choose this billing company because they're going through this extra step of accreditation to ensure that they know how to protect patient data, that their security, they've completed a security risk analysis. They've got disaster recovery plan in place, if something does go wrong, and that they'll protect, in a way, be an extra protection for that practice. It's a big deal, and adds a lot of value for these groups.
Well, and it's a good selling point for providers who have tried to go with a lower cost service but seen that they're not bringing in as much and that they're having some issues with
Yeah,
compliance possibly, and they're trying to catch it before it gets out of control. I mean, yeah, that's the
absolutely.
perfect scenario to say, what, my services might cost a little bit more than what you've been paying, but the peace of mind I can provide you with is irreplaceable.
Absolutely. Yeah, it's great. And some of the things that we do, we make sure that all your employees are trained on all the required courses that are out there from a federal regulation. Somebody on your staff, we have a special course built out for HIPAA privacy and HIPAA security, a certification course. So somebody gets to become a HIPAA certified, officer essentially for your organization, which is a huge deal. And then we
Yes.
help you with your security risk analysis, which, on its own, can be really difficult to do if you don't have somebody guiding you through it, or expensive to go find elsewhere. But that's part of this program and this opportunity. And then again, we help guide you through all best practices with business associate agreements, and making sure that everybody that you hire is checked against any of the OIG or SAM exclusion lists and have not been in trouble, for any fraud issues in the past, right? Which again, so as a provider, to know that everybody that works with this medical billing company is checked and screened, and is somebody that is trustworthy is a big deal. Okay, so Katie, those that are listening that are interested in potentially learning more about AMBA and getting in contact with you, what's the best way to do that?
They can go to our website, www.americanmedicalbillingassociation.com. And if you select on the webinars option, we have 2 webinar series. I always, encourage people to check out our webinars if they really want a good introduction to us. In
Yeah.
less than an hour's time, they can really get a feel for what we're all about in those live events that are free. And if you're certified with AAPC or PMI, you can get free CEUs from our webinars. And we have a sponsored series and a compliance series with Lyles Parker. We have one coming up next week. We usually have one every other week.
Yeah, great. And then the conference this year, October 16th and 17th in Las Vegas.
Yes.
Okay.
And we are slated to have our biggest event yet. We have more registrants at this time of year than we did last year, and last year was our biggest event so far. We are almost full on vendor spots. So I'm going to be really sad for anyone that doesn't get a spot that wanted one. Like we have like 2 spots left. So,
Wow.
and we're still looking for sponsors, but we're excited about it. It's going to be a great event.
Is it the 25th anniversary then? Like, are you
Yes.
celebrating 25 this year then?
A quarter of a century.
Wow. Well, congratulations, Katie, to you and to your family, really. The legacy that
Thank
your
you.
mom and then dad started together, and now that you're carrying on, it's amazing, and it's helping so many groups and organizations and companies just be better and make sure that they're doing things the best possible way.
And a lot of the people that you'll see speak at our conference are people that are at other conferences that you'll be at this year too, probably. But the
Yep.
difference is that our conference is a little bit smaller and more intimate than some. And everybody is just so welcoming. Like if you just start a conversation with anyone, like they'll talk to you, they'll answer your questions. And it's a good way
Yep.
to connect with experts and connect with vendors that you've been wanting to meet, like healthcare compliance pros. You guys are going to be there.
Oh, we're there. We're signed up and ready to go, and we're really excited to go back for round 2 with a lot more knowledge and understanding of the organization under our belt. It's gonna be fun.
Yeah, it's going to be a lot of fun.
Okay. Well, thanks, Katie. Appreciate you being on the show, and maybe we'll do a post conference conversation and celebrate 25 years.
Yeah. Thanks,
Okay.
Jeremy.
Take care. Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.